Hi, my name is Aram Drahin. I am a student pharmacist, and today I will be speaking to you about tuberculosis. Tuberculosis is a disease caused by bacteria. It is normally spread in the air when a person is infected actually coughs, sneezes, speaks, or sings, and people that are close by breathe in the bacteria. It normally attacks your lungs, but it can also attack other organs such as your kidney, your spine, or your brain. Not a lot of people who actually get exposed to it will feel sick. This is because the disease actually has two stages. You have a latent state, and you have a full-blown tuberculosis disease. In the latent phase, your immune system does a great job at fighting off and it contains the bacteria, so it prevents it from spreading and being able to cause an infection. At this point, however, you still have the bacteria in you, and at any time it can spread. And at that point, when it does spread, you do have the tuberculosis disease. So what are the signs and symptoms that will indicate that you do have it? The signs and symptoms could be a cough that lasts for 3 or more weeks. You may have chest pains, fever, coughing up blood or phlegm, sweating at night, chills, weakness or fatigue, and a loss of appetite. So what drug therapies do we have available for us? Well, because TB has 2 different disease states, there are different drugs used to treat each state. If you're in the latent state, a physician will prescribe treatment to prevent the bacteria from becoming active, which could lead to a TB disease. Treatment is easier at this stage because there's less bacteria to fight off. So commonly used drugs are isoniazid, rifampin, and rifampicin. When you actually have a TB, when your immune system is unable to contain it, treatment requires taking several drugs for 6 to 9 months. Drugs include isoniazid, rifampin, ethambutol, and pyrazinamide. So how do these drugs work, and what are the different dosage and routes of administration for them? Well, let's take isoniazid first. Isoniazid works by interfering with the bacteria's proteins, nucleic acids, carbohydrates, and lipids. It appears to inhibit the synthesis of mycolic acid, which is a fatty acid important for the cell wall structure, antibiotic resistance, and overall life of tuberculosis. The only unfortunate thing is with isoniazid is that tuberculosis has recently built up a resistance to this drug, which prompts the need for alternative therapies. So the dosage and routes of administration for when you have a latent infection. Medicine is normally given orally or via intramuscular injection. The dosage amount is based on the person's mass, so the CDC recommends 5 milligrams per kilogram once daily, capping at 300 milligrams per dose. This treatment plan lasts 6 to 9 months for those who do not have HIV infections, and normally the 9 months is the ideal therapy. So when you have an active infection, the medication is the treatment is similar to the latent phase. So it's normally given orally or intramuscularly, and the CDC recommends also 5 milligrams per kilogram once daily, capping at 300 milligrams per dose, or 15 milligrams per kilogram twice or 3 times weekly under directly observed therapy. Rifampin. Rifampin's mechanism of action is it prevents the RNA chain from forming an RNA synthesis. Rifampin is given orally or by intravenous infusion if you cannot do oral therapy. So it's taken either alone or as a fixed dose of isoniazid in capsule form with 1 glass of water either 1 hour before or 2 hours after a meal. It's rifampicin. It is a derivative of rifampin, so they work similarly in the mechanism of action. Rifampin interferes with several enzymes that break down drugs. In contrast, rifampicin has intermediate effects on some same enzymes. So for the active stage of TB, there are 2 treatment phases of rifampicin. The first stage is the initial and intensive treatment phase, which lasts for 2 months. During this time, you have 600 milligrams of rifampicin is taken twice a week. The second stage is the continuation treatment phase, where 600 milligrams is taken once a week. The length of the stage depends on the sputum smears done after completing the initial phase. If the smear is negative, then the second stage will be 4 months. But if it is positive, then the second stage will be 7 months. Ethambutol is a bacteriostatic medication that inhibits the bacteria's ability to synthesize one or more of its metabolites, including its cell wall. Well, this will impair the bacteria's cellular metabolism, which results in a halt of bacteria's multiplication and ultimately lead to cell death. Unfortunately, there has been acquired resistance seen in a few strains of Mycobacterium tuberculosis. So dosing. Dosing for this the active infection is given orally, 15 milligrams per kilogram once daily in adults who have not undergone treatment before. Those who have previously undergone treatment are given 25 milligrams per kilogram once a day for 60 days, followed by 15 milligrams per kilogram once daily. Okay, lastly, I would like to discuss about pyrazinamide. Pyrazinamide is activated by acidic conditions, which can normally be found at the edges of necrotic TB cavities, where inflammatory cells will produce lactic acid. Normally, pyrazinamide it's used in conjunction with other anti-tuberculosis, and should not be used alone as the primary treatment of TB. It is given by mouth 15 to 30 milligrams per kilogram per day. There are several different regimens that healthcare providers must choose from. This is based on the effectiveness of certain drugs in patients, coexisting medical illnesses, and the possibility of drug-drug interactions. Thank you for watching this video.